When we think of our health, what comes to mind? Preventing disease, eating nutritious food, or working out at the gym. These are all beautiful. What if we had the tool to help us take charge of our health? Think of the weatherman on television who forecasts the changes in weather. It might rain today, so I take my umbrella. You see, forecasting the weather allows us to better prepare our daily lives. Why can't we do the very same thing with our own health? For patients, there has been limited ability to identify the changes in their own health, as well as limited support from the health community. For physicians who want to prevent worsening conditions, there are unfortunately limited tools to interpret patient health data, as well as minimal tools to help educate patients about their own health. And for payers, there is both inefficiency in care management as well as patients not taking ownership of their own health. However, at DynoSense, we have resolved these issues.
We begin by understanding the patient's condition. We collect health information from a variety of sources. The symptom information is gathered via our health scanning devices as well as from our patient's electronic health records. We can also gather psychological and behavioral data from our app portal. All this information is securely stored and analyzed in the cloud to ensure patients' health data privacy.
The collected secure raw data must be structured into meaningful classifications or bins of health information, such as vital signs, biometric, environmental, lifestyle, or behavioral states, as well as lab data. Each data group will be trended and cross-checked against standards to create a personalized health status. Furthermore, data is trended and aggregated into an individualized health score and demographic grade. Using a medical decision support algorithm, we can identify a series of health guidelines that care provider can assess for possible future actions.
As a physician, I know there's a lot of information collected on patients, and being able to sort through that information and come up with a treatment plan is very difficult. Doctors only have, on average, 8 minutes to spend with each patient. And during that 8 minutes, they're spent mostly going through that data, looking for key information or changes in that patient's profile. DynoSense has taken that raw data and churned out useful summary information that doctors can use directly in patient care.
As a nurse, with a personalized plan of care, I can much better coordinate and communicate with the providers and the patient. I can monitor and guide the patient and their family for their role in the plan. With DynoSense, I get alerts when things change. I can communicate with the patient, and I can make arrangements for a further blood test, an office visit, or provide them educational materials and videos. With a sudden weight gain in a patient discharged from the hospital, I get an alert and I can prevent or avoid a very costly ED visit or hospital readmission. This close and personal relationship will lead to improvement of the patient's overall health and well-being.
So, just like forecasting the weather, you can now take an active role in forecasting your own health. Now, we have empowered you to be an active player in the most important aspect of your life. So, come and join us.